Most people believe that health is mostly determined by the quality and accessibility of our healthcare system. The truth is that the major determinants of our health are the economic, physical, and social environments in which we live and work. Unfortunately, those environments vary dramatically in our society, so not everyone has the same opportunity to be healthy. That means that the level of your health may be determined by your race, level of education, income, or zip code. Effectively addressing those determinants of health is essential if we are to achieve health equity in our society. On today's episode of A Public Health Journal, we're going to look at some of the ways to do that. Please stay tuned.
Welcome to A Public Health Journal, a program that explores the public health issues facing our society today and tomorrow. The host of our show is Dr. Ed Ehlinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health, the Hennepin County Human Services and Public Health Department, and the Minnesota Public Health Association, all working together towards the goal of healthy people living and thriving in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at one of the approaches being taken to address the social determinants of health. That is, the social and economic conditions outside of the healthcare system that affect the health of individuals and communities. In particular, we'll be discussing the work being done by Take Action in Minnesota, a statewide network of people working to realize racial and economic equity across Minnesota. We will also be focusing on Take Action's work to reform the justice system and remove barriers to formerly incarcerated and convicted Minnesotans. Joining me in this discussion is Justin Terrell, Project Manager of the Justice for All program at Take Action Minnesota. His work around the justice system focuses on voting rights restoration, fair hiring practice, and police accountability. Justin, welcome to our program.
Oh, thank you for having me. I'm excited to be here.
Yeah, and we have lots to talk about, but I want to first start out, you're part of Take Action Minnesota, and I think a lot of people may not know what Take Action Minnesota is. So what is Take Action Minnesota?
So Take Action Minnesota, we are a statewide people's network focused on racial, economic, gender, and social justice, right? At our core, we're organizers, and our goal is to ultimately build statewide multiracial power, the power to govern, right? So we want people in control of the state who share our values and who are willing to lead alongside with Minnesotans across the state, advancing a different and better and stronger Minnesota.
You talk about values. What are the values that underride all of the work that you do?
Yeah, so we believe that in racial equity, right? That your skin color shouldn't determine the type of health care you get, or how the justice system treats you. We believe in gender justice, that equal pay for women, but also equal access to justice for our transgender communities, and we don't want women's bodies criminalized. We believe in the sacred feminine. There's tons of values that we just believe are most likely progressive values is the easiest way to describe them.
So why did Take Action get formed?
So Take Action was formed out of the two organizations that we're trying to figure out how to get bigger, stronger, and move our state in a different direction. And so we're 10 years old, and some of our fights have been around photo ID in 2012. Some of our fights have been around healthcare. So we challenged the insurance companies to give back money to the state that this profits that they were making off of people in the state of Minnesota. And we've also passed Ban the Box, which was really our effort was to move Target Corporation to support fair hiring practices, and in the process they supported Ban the Box. Mm-hmm. So those are some of our victories. We've been around for 10 years. We're excited for the next 10 years. We're looking forward to resisting this year with our current political landscape at the national level. And we're excited to just bring more people together to demand, justice.
So who are some of the partners that you work with throughout the state? You have who belongs to Take Action, and then who else do you partner with?
Yeah. So we are a membership organization. So that we have individual members who support our work, but we work in coalition. We never go alone. So we work with Neighbors Organizing for Change, or NOC, which is based in North Minneapolis. We also work with Land Stewardship Project and Isaiah. We have Satul, who organizes workers, which is a working center in South Minneapolis. We have partners across the state who are always willing to stand up and demand justice.
Mm-hmm. And so you do work across the state, and I know a lot of the work happens in the Twin Cities, but what are some of the things that are important for the rural communities throughout our state?
I love this question. So a lot of our work in Justice for All, which I'll talk about later, it comes from low-income communities like North Minneapolis. So we'll take a north side guy and put them on the phone to talk to somebody in like Wilmer. And the reason why those conversations work is because they have so much in common. So in Caney, Ohio County, whatnot, they're struggling with jobs. Well, we're struggling with jobs in North Minneapolis. And there's this great connection between these communities where there's not as big a divide as people argue or politicize. People care about jobs in greater Minnesota. They care about jobs in North Minneapolis. People are worried about how the shifting dynamics in their communities in greater Minnesota. People are worried about the gentrification on the north side. So it's like we have a lot in common, and it's a really powerful conversation to have.
Right. And so there are so many issues that are there. How do you choose which issues? You know, you had minimum wage and paid leave and sick leave and marriage equity and health equity. How do you choose the issues?
You know, the people really choose the issues, right? Like our members decide what we work on. So when it came down to photo ID, like a lot of people said it was a slam dunk and we shouldn't work on it, but our members said this is important to, you know, the elderly, the people of color, low-income folks, students. And those are the folks we listen to, and that's kind of where we settled on our main issue. So healthcare, criminal justice reform, climate justice, and the economy.
All right. So photo ID, explain a little bit for people who may not know about the importance of this.
So this was in 2012. There were 2 amendments on the ballot that year. One of them, constitutional amendments, state amendments. One of them was to pass photo ID, requiring people to have an ID to vote. This was important, especially to me, because now we're running a restoration of voting rights campaign that is just about expanding democracy, and these policies like constrict democracy and keep people from voting, sort of like deciding who is worthy of voting. And that's just something that we're not going to tolerate. Everyone who is governed deserves a right to decide who governs.
So this is really a voting rights issue, and we've seen it throughout the country that people were, you know, voting participation decreased because of, you know, barriers that were put in place.
North Carolina, Michigan, Wisconsin.
All right.
Yeah.
All right. So we're going to take a little break, and then we're going to come back and talk about the aspects that you do with Justice for All. But we're going to take a little break, and we're going to show a video that explains in a little bit more detail what Take Action Minnesota is all about. So enjoy this video.
10 years ago, we were on the defense. Our environment was under attack. We were losing our homes, our savings, our everything. We were fighting 2 wars.
Leaders from across Minnesota came together and asked each other, how can we build a stronger movement? How do we tell our own story?
How can we fight for and win the kind of bold solutions we know will work?
The goal wasn't just to pass a bill or win a campaign. It was to tear down structural racism, gender oppression, and unbridled corporate power.
The barriers that stand in the way of a future for all of us and by all of us. 10 years ago, Take Action Minnesota was born to change who decides and who benefits.
We started to tell our story, rooted in our values.
We know we're all connected to each other, that our fates are tied together,
that there must be justice for all,
that there is more to life than work and struggle,
that we are all entitled to live a life filled with joy.
We knew that we couldn't do it alone, so we developed leaders, built coalitions, and took risks with other movement organizations.
Together, we won what others thought was impossible.
Whether we were holding a corporation accountable to close the racial jobs gap, or working with courageous elected officials to pass Earn Sick and Save Time,
we have, bit by bit, put more power in people's hands and changed who decides and who benefits in our state.
We've made the road by walking side by side with others.
Sometimes we tripped, sometimes we got lost, but we never stopped moving forward, together.
This is a deeply troubled time. We are afraid for our families, our communities, for all of us.
And that's why now, more than ever, we need to hold each other and hear each other.
We need each other's strength, courage, endurance, and humor.
We are in this together, and we will fight side by side.
Let our joyful rebellion begin.
Welcome back. We're talking with Justin Terrell from Take Action Minnesota and the program manager for Justice for All. Justin, thank you for that video. It explains a little bit about who you are and the progressive nature of the organization. I want to take a little bit more in-depth focus on one aspect of the work that you're doing in relation to incarceration and health. And we did a report, or we're in the process of doing a report at the health department, that incarceration and our criminal justice has a huge impact on the health of individuals for a whole variety of reasons. And so that's why it is a huge public health issue. So I know you're working on, the criminal justice system and all of its permutations with this Justice for All program. So explain a little bit about what the Justice for All program is.
Yeah, absolutely. First, I also wanted to say thank you for the work that the health department is doing on answering those questions. So Justice for All, we are focused on removing barriers to employment, democracy, housing for formerly incarcerated Minnesotans, convicted Minnesotans, which I myself have a criminal record and know what it's like to lose a job because of my criminal record or not be able to get housing because of a criminal record. So our goal is to bring as many Minnesotans impacted by the justice system together to talk about what issues impact us, and then build strategic campaigns to go and remove those barriers.
Mm-hmm. So why is this a health equity issue? Why is it an equity issue?
Well, as you know, the Department of Corrections is the largest healthcare provider in our state, specifically around mental health, right? Like there's a huge problem in our state where if someone with a criminal record just doesn't have access to health, right? If you come out of prison, there's barriers to getting health care, which perpetuate other issues in communities. So when someone doesn't have access to health care, and they can't take care of themselves, and they're living with somebody who they're not supposed to be living with, it creates a cycle where people just end up going back into the system.
I also know that if you're incarcerated, it's hard to get housing, which is a health issue. It's hard to get a job. Like you say, it's harder to get health care. It's harder to get back in the educational system. All of those things impact health. So are you addressing all of those factors?
So, I mean, specifically, like we can only do so much at one time, right? But it's the building and understanding and analysis that all these systems work together and impact each other is really important to our work. So right now, our top issue is restoration of voting rights, because we believe that if someone is on probation, living in community, on felony probation, that they should have the right to vote for the people who govern their communities.
So what is the situation now? If you have a felony, you cannot vote?
Yeah, so there's 51,000 Minnesotans in our state who can't vote or who didn't vote on election day because they're on felony probation. And so that's our top priority right now, is changing that so that people have a chance to elect the people who have control over the systems in their community.
Mm-hmm. So why was that restriction put in place, and why should it be overturned?
So the restriction technically was never put in place, right? So our state's constitution says you have to complete your sentence before you can vote again. However, when we wrote our state's constitution, there was no such thing as probation. And so, when we developed probation, we decided that was just a natural piece of the sentence. We would argue that if you are in community, even if you're still on probation, being on probation is not the same as being incarcerated, and that you should be able to vote.
All right, and what benefits would that bring to the community?
Well, I mean, if you think about people who control the resources that go into the community, you got county commissioners, judges. You have people who have kids in public schools and can't vote for school board. You have people who have been to prison and can't vote for judges who send people to prison, can't vote for your prosecutor. So you have all these folks in the community, and sometimes you're talking about long probation periods, and people have no say over the justice system that they are part of. And that's just not how America should be.
Yeah, and this policy, these actions actually disproportionately impact people of color, don't they?
Absolutely. So like the overwhelming, white folks in Minnesota make up the overwhelming majority of people, like by the numbers. But when you think about population, 5% of our state is African American, 35% of the people in prison in our state are African American. That is outrageous. Black folks are 11 times more likely to be to face incarceration or be impacted by the justice system than white folks. And it has a huge impact on employment, housing, and everything that we're trying to solve in our state when it comes to racial equity. This is I mean, this is also a huge healthcare issue. I mean, when you think about being black in Minnesota is a determinant of life expectancy and our actual health, right? Like heart disease and whatnot. And you wonder, you got to ask the question, you know, how do all these systems play into that?
Yeah, and I know, you know, ask the question that I know people say, well, African Americans, they commit more crimes. That's why they're more involved. Give me, what's your explanation to that?
You know, I would say first, it's not necessarily true across the board when it comes to drug crimes. So we know that drug crimes are a big reason for mass incarceration. We have the war on drugs, and we know that white people commit the same, if not more, amount of drug crimes, right? So selling, using, like it is reported, the same uses or higher, right? But what we also know is that a kid smoking a joint in North Minneapolis on a stoop is 11 times more likely to to have the police roll up on him than a white kid in Dinkytown smoking a joint on the stoop of his frat house. Mm-hmm. Now, there's no debate that this behavior is happening in those two communities. However, one community is over-policed and targeted to address that behavior, and another community is not.
Mm-hmm. All right, so let's turn a little bit to you talked about employment, and you talked about ban the box. Tell us about that thing.
Yeah,
ban the box.
So Minnesota has one of the largest racial jobs gaps in the country. You know, we're talking about folks of color in just being, you know, pretty much blocked to employment in a lot of ways, and criminal record is one of those. 90% of employers use criminal background checks. And so in 2012, we engaged Target Corporation to change their hiring practices. And, you know, some of the video that you saw, there's some moments there where we, you know, hung out in their lobby with a couple hundred people, and Target actually became a really strong partner on this and came to the north side at the Capri Theater and sat down with some of our leaders, people who had been incarcerated for 27 years, and talked about the need to change their hiring practices, and they did. And so Target removed questions about criminal records from their application, and that is what ban the box is.
So it's the box on the employment form that says I have a criminal record.
Yeah, and it just basically your application goes in the garbage when the employers do that. I will say, Commissioner, that the state of Minnesota is not complying with this law at the rate that it should be. So we have to work on that. But removing questions about criminal records from job applications, it just gives people an excuse to apply for more jobs and gives people access, because now employers have to seriously consider you before they ask you the question.
All right, good. Well, I have a few more things that we want to talk about, but we need to take another little break.
Thank you.
We'll be back right after this message.
I'll be right back.
Hi. You think you're probably sober?
Yeah.
But you're thinking about taking the back roads home, just in case. If you're probably sober, then why would you do that? Good choice.
Probably okay isn't okay. If you see a warning sign, stop and call a cab, a car, or a friend.
That's a full glass of wine. I'll be chatting you later.
Welcome back. We're talking about Justice for All and Take Action Minnesota with Justin Terrell, a program manager for Justice for All. One of the other things that I want to talk a little bit about sentencing guidelines. You know, and we know that we have a lot of people in prison. The United States has more people in prison than any other, you know, industrialized country. Tell us about why we incarcerate so many folks and how sentencing guidelines may play into that.
Yeah, so this is true. So America, we make up, you know, I think something like 5% of the world's population. We incarcerate 25% of the world's population, more than China, more than Cuba, you know, all the places we like to criticize for human rights. And we could talk about solitary confinement and how that's been seen as torture, but we have a lot of issues with mass incarceration in this country. Wait, repeat your question.
Yeah, so sentencing guidelines. How did that play in? You know, do we have guidelines that put people in too long, too short?
So our state actually has this thing called the Sentencing Guidelines Commission. So these are people who actually take their job very serious and have the authority to set sentencing guidelines. In Minnesota, we have a pretty complicated equation around that. But what I will just say, like, simply put, is that we need to reconsider how long we're locking people up for and sentencing them. We would like to see more judges with more power in judges' hands to decide how long people should go away for, and we want communities to be involved in that process as well. Right now, it's more like an equation, like how long folks, how much criminal activity people have in the past and whatnot. And we know that this is a big problem, because sometimes you get long probation periods and shorter incarceration periods, which is nice to have people in the community, but the big issue with prison population is actually probation revocations. So just about a third of the prison population in Minnesota is there on their second or third.
Because they violated their probation.
Yeah, and about 1,200 folks shouldn't be there at all because they haven't broken a law; they've broken a probation rule. Yeah. And so these kind of in the weeds policies are kind of complicated, but like we could solve these problems. We could get people out of prison, get them in community, give them the supports they need, and start to change. Reduce crime by making sure people have access to, just being a regular citizen.
Mm-hmm. Right? Are there inequities in sentencing?
Absolutely. First, you have the inequity of just being with communities of color being impacted by policing more, right? So off the top, you get more people of color into the system that way, and then you see people being sentenced for the same crime. People of color being sentenced at a much higher rate or getting much harsher penalties. It's not the same crime, but I think like a dramatic example of this is Denny Heinrich and the Somali youth who were trying to get to, who were trying to participate with Al Shabaab and whatnot. The same week they were sentenced. Denny Heinrich got 20 years. Now the argument about Denny Heinrich is that here is the guy who is the reason we have a sex offender registry. He is the guy who started all of that because of the Jacob Wetterling crime, and he got 20 years. And one of the youth who basically, admitted that they had interest in committing terrorist acts got 30. And so that is not a coincidence, and we have to really consider, like, what does that really mean when we have just nonstop, it seems like, harsher penalties handed out to communities of color, and regardless of the heinousness of their crimes.
Yeah. So there's all of these issues that you're dealing with. How do you make change? What's the strategy that you use to try to make change? These are changing policies. These are changing laws. These are changing practices that have been in place for sometimes hundreds of years. What's the strategy that you use?
Yeah, I think we believe that when you bring people together around shared values and shared resources, you can change the world. I mean, that is just at the core of organizing. That is just what we believe. So, we can talk about political agendas, and we can talk about the need for structural change. We believe we need structural change. So it's not just about helping individuals, but it's about creating change at the policy level that is far-reaching enough to actually create real structural change in the ground that we are standing on, right? But at the end of the day, like, none of that happens without bringing people together around shared values to share resources and advance strategic campaigns.
And so what are the barriers that you're running up against?
There's tons. I mean, racism, gender oppression, corporate power, right? Like the video names. We know that we live in a capitalist society where people prioritize profits over people. Anytime where you see that happening, we need to stand up and say, no, it should be people over profits. We know that racism is very alive and well in the world that we are living with. Even though we've seen our first black president, we've seen a dramatic swing the other direction. Now that people feel like they have like some sort of moral authority, they did the right thing in supporting black folks. Now it's like going the other direction where we have an increase in hate crimes and white supremacy coming out now, right? Gender oppression, we have to remember that women are not paid as much as men. People still believe they have the right to legislate women's bodies, even though they are not women. These are the barriers that we're up against. This overall dominant narrative that decides, that is based on who is worthy and who's not. And our goal is to change who decides and who benefits.
Yeah. And I suspect the faith community is partners with you?
Absolutely. Like, we work very close with Isaiah. We work closely with, right now Isaiah is leading an effort with churches across the state who wanting to make sure there's sanctuaries for people who are feeling threatened by their immigration status and what the government is doing to potentially going to do to try to, chase people out of our communities. And so, yeah, we work very close with the faith communities.
Good. Well, Justin, this has been very informative, working on a very inclusive and fair and just environment for everybody in our community. Thank you for the work that you're doing, and thanks for being on the program.
Thank you for having me.
And I'll be back with a closing comment right after this message. The Minnesota Department of Health has made advancing health equity the central focus of its effort. To do that, it has developed a framework called the Triple Aim of Health Equity for guiding that work. The first aim is to expand the understanding about what creates health. That means we must get beyond thinking that health is just about health care and focus more of our efforts on improving the social determinants of health. The second aim is to implement a health in all policies approach with health equity as a goal. Health is impacted by all sectors of our society, not just the public health and healthcare sectors. People in all sectors like transportation, housing, economic development, and criminal justice need to consider health in all of their programs and policies. And the third aim is to support the capacity of communities to create their own healthy future. That means that communities must find ways to become effectively engaged in and take ownership of the multiple social and economic issues that impact their health. Basically, it means strengthening our democracy and giving an effective voice to everyone in the community, particularly those who have been systematically disadvantaged over the last 2 centuries. Take Action Minnesota is a good example of how that can be done. Building community capacity may be the most important part of the triple aim of health equity, because without the voice of the community in policy and program discussions, the inequities within our society will continue. That's why I believe that community organizing, which builds community capacity, is a powerful public health tool. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.